A DVT is a deep venous thrombosis, and that is a blood clot that will form in a deep vein of the legs. Those are not veins that we treat in a varicose vein practice in the office. Basically, a DVT is a blood clot in the veins in the legs that will start, normally it could start up in the thigh, but often it will start in the calf and then grow forwards. And the danger of a deep vein thrombosis is that a large piece could break off and go up to the lungs and form what's called a pulmonary embolus. If a pulmonary embolus is large enough, then it can be just fatal. Smaller pulmonary emboli can cause symptoms of difficulty breathing, tachycardia, sweating, apprehension, chest pain. And if somebody has any one of those symptoms, especially with a combination of leg pain, then they need to have that looked at right away. And DVTs can be very, very dangerous, but they can be treated. DVTs that don't have a large pulmonary component, in other words, they're not symptomatic of a pulmonary embolus, are normally just treated with anticoagulants. So the typical course would be somebody would go into the hospital, be put on some anticoagulants, and those would be regulated before they leave the hospital, and they would leave the hospital and be on anticoagulants for say 6 months or a year. And they should wear compression hose after that too, because that helps to do two things. It helps to make sure the venous reservoir in the legs don't get really dilated, to kind of make the deep veins a little bit smaller and flow better to get rid of the DVT, and it also prevents post-thrombotic syndrome. DVTs that are extensive in the lower legs or come up into the pelvis can also be treated in the hospital with a process called catheter-directed thrombolytic therapy. And that's a big term that basically means that you put a small catheter into the veins of the leg, normally behind the knee in the popliteal vein, and that catheter will be placed up into the thrombus, into the blood clot, and then a special medicine called thrombolytics will be delivered through the catheter, and that will dissolve the blood clot. And there's some other things that can be done, like with balloons and placing stents, but that's stuff that's done inside the hospital and not done inside of an office vein practice.